Good morning and happy Friday. I'm Dr. Lastra, pediatrician at Head2Toe Pediatrics, and in today's video, I'm going to be talking about COVID swabs. So I'm going to tell you a little bit about my experience getting swabbed, and I'm going to provide some tips on how we can help our kids when and if they have to get a swab for COVID. Now, there are more tests coming along that provide different alternatives than the swab. So there's some oral options where you could swab the back of the throat, similar to a strep throat test. And there's also some options where you could spit into a container and the spit can be used as a sample. But I would say most frequently what you will encounter is this swab. So it comes in a sterile baggie, and we remove this from the bag when we're going to be doing a sample on the patient. So I actually have one that I've taken out just to show families what it looks like. And this is a sample of the swab itself. As you can see, it's a very long stick with soft bristles at the end. And this bristles is where the sample is going to be collected. So this is used for both the nasal and the nasopharyngeal swabs. And the nasal usually goes up to about here or so. So it just stays in the nose area. The nasopharyngeal goes a little bit further up. You may have heard some people saying it's the brain swab, but it does not actually go all the way back to your brain. It just kind of goes back to your nasopharynx and it grabs the sample from that area. Some places only swab on one side. Other locations may be swabbing both nostrils. Typically, when you swab both nostrils, it's about 10 seconds on one side and then 10 seconds on the other side. I've also had the swab where it's been 20 seconds on one side or 10 seconds on one side, and that's usually been the deeper nasopharyngeal swabs. I can say from my experience as a healthcare worker, I've definitely been swabbed quite a few times, and it is uncomfortable. So it's important to warn kids when they're going in to get a COVID swab and to help them feel comfortable with the procedure. So I will say with the nasal swab, it felt like a tickle, and I felt like I wanted to sneeze. When I had the deeper swab, which is the nasopharyngeal swab, I cried. I felt like tears came out. It was uncomfortable during the moment, but it wasn't anything that was not tolerable. It really made me feel like crying. After the procedure, pain completely goes away. It's very quick, so it's really only uncomfortable during the time that you're actually getting the procedure. In prior posts, I talked about the different types of testing that there are, so the PCR and antigen testing, and some advice and guidance on when to do what, so I'd like you to refer back to those posts for more information on that. This isn't always the easiest thing for kids, so I wanted to share some tips that parents can do or some tips that they can use to help relieve the stress and anxiety that some of the kids may have when it comes to getting swabbed for COVID. So here to help me today, I have Mickey. Woohoo! And I will say one of the most effective things that you can do is role play with your child, as this will help relieve some of the stress with testing. So I like to separate it into 3 categories. So what you can do before a child is going to get swabbed to help them understand and feel more comfortable with the test, what you can do during the test, and what you can do after the test is done. So before the test, going back to role playing, you can get a cotton tip or what you used to clean your ears with, ear swab, and you could use that as your COVID swab and gather some of your kids' favorite toys, and you could role play. So you could be like, oh, Mickey, you're gonna go get swabbed today. Are you ready? Here we go. We're gonna put the swab in your nose, and explain what to expect throughout the process. So you're gonna have the swab in your nose, it's gonna go, and we're gonna twirl it, and we're gonna count. Ready? 1, 2, 3. Counting is another way to help during the testing, so you can start to incorporate this during your role play. Something also important to discuss before an exam is to tell the kids about how the person who's going to be doing the testing is going to be dressed. So if a kid hasn't been to a clinic recently, it may scare them to see us healthcare professionals with what we call PPE, which is protective medical equipment. So that includes masks, face shields, gowns, gloves. So we may appear like a little bit scary to some kids. So it's important to start talking to them about this as well. You can go on YouTube and show them some videos of what this protective equipment looks like. There's some child-friendly videos as well on what the testing is like. So that's my favorite tip on what to do to get kids ready before they're gonna have their test done. For the time of the test, when the child is gonna go get their test done, it's really important to not say anything that would be scary for them, or say lots of positive and reassuring things. When the child is getting tested, some clinics will have you stay in your car and they'll do the testing. When I come to the home to do the testing, we would likely be doing the testing in an outdoor area of your home, depending on the weather and the age of the child. So it's a little bit more comfortable for the kids to be in an environment that they already know and trust. But if you're going elsewhere to get the testing done, one of the things that you can do is just bring toys or some of things that are familiar to your child for them to have with them at the time that they're going to get the testing done. So when the provider is getting ready to do the test, one thing that you can do is either sit next to your child and you can put an arm around them to help comfort them. Hold them gently and just, you can, soothe them. You can also just put them on your lap like this and just on top of your lap, and then put your arms gently above them. And then you can say some soothing words to them during the procedure. You can explain what's going on if your child is one that likes to have explanations, or you could just sing to them, count with them, read stories, keep them distracted with a video or a book or anything that helps keep your child distracted while the clinician is going to be doing the procedure. Reminder that the procedure takes about 10 seconds in each nostril if they're swabbing both nostrils, or 10 to 20 seconds in one nostril. So even though it's seconds, I can tell you from my experience, those seconds can seem like a very long time, and for kids it can seem like an eternity. So something that may help is at the time that they're doing the procedure is counting with them. So you can tell your child to take a big breath and slowly let it out and count to 10 or count to 20. Close their eyes if they don't want to be seeing the swab coming at them. Those are some other things that are helpful. And we do have some kids that no matter what we do, they're just not going to want to get tested. They're going to fight you. They are going to run away. So in cases where you do have to do a little bit more of a restraint to hold your child, some of the things that helps us, your medical provider will tell you the best way that you can help them as a parent to get the testing done for your child. But one of the things that I like, a hold that I find that is very useful, is with the legs. If you put them on your lap and then you bring your foot kind of over, let's show you that, over their legs, so it's kind of restricted like this. And then while you're holding their legs down, then their little arms, you kind of hug them with your other arm, and then you can put their head against your chest and then softly hold the top of their head. So that's if you have to restrain them. Hopefully you won't have to do that, but that can be an effective way to hold your child while the exam is getting done. And then test is done, swab is out. What's gonna happen after? It's very common that your kid may cry, they may be upset, they may feel uncomfortable. It's important to let them express their feelings and help guide them through the process, to let them know that they didn't do anything wrong and that it is okay to feel upset from the test, and reassure them with their feelings. You can have a reward for them after the test. For babies, definitely expect them to cry for a little bit. Usually what I typically see is they'll cry for about 20 seconds and then they forget about it and go back to their normal routine. Whereas older kids may cry a little bit longer, or they may be a little bit more uncomfortable, or just be upset for the rest of the day. So just giving them time to express their feelings and, you know, get through those in a positive way. And for the test, this could be done as young as 0 days old. So we've had babies have the same swab testing get done, and it's the same swab that we typically use for adults. So I hope all these tips and information were useful. Mickey says hello to everybody. Send us any questions that you have and we'd be happy to help. Have a wonderful rest of your day and Happy New Year.